Hello, this is Dr. David Pascal. Welcome to my Facebook Live. And today we are going to be talking about the role that chiropractic care and quantum neurology play in helping people with CRPS become symptom free. If you are watching this, then you probably already have some familiarity with CRPS. Either you have CRPS yourself or you know someone that does and you're seeking more information for relief. CRPS is a very complex, right there in the name, um, terribly painful condition. And unfortunately, it is quite resistant to care. Only about 20% of all the people that have CRPS find relief with regular care, whether that's medical care in the form of medications like pain relieving drugs or something as strong as ketamine, spinal cord blocks, nerve ablation, spinal cord stimulators. All of these things can help a small portion of people with CRPS. Also, other care like physical therapy, chiropractic, acupuncture, all of these, along with Western medicine, all add up to only being able to help about 20% of people with CRPS. I've talked about why that is in earlier lives, but the main reason is that CRPS has multiple causes, and usually most therapies only address one, and therefore one or two of the underlying causes, and therefore it has a poor success rate. The people that come to me are in that 80%. They've already seen multiple doctors of all kinds, tried multiple therapies, multiple supplements, every different thing that they could think of as they are searching for relief. And in our office, that is exactly what we are looking for, is relief for our patients that are suffering from CRPS. And fortunately, we are able to put about 80% of all the patients that see us into remission. And chiropractic is part of that. And I want to talk a little bit about exactly what chiropractic care is. A lot of people don't know. Really, chiropractic is using the body's own nervous system to heal itself. We all know the brain controls the entire body. It does that through our nerves. Our nerves are forming a giant cable or spinal cord that's going down our spine, which isn't one bone, but a whole stack of bones, vertebra. And we get little branches coming off as the spinal cord goes from the top of our head all the way down to our tailbone. And these nerves come out through little holes, and there are a lot of nerves. There's nerves that carry organ function, there's nerves that go to muscle function, there's nerves for sensory, like pain nerves, light touch, vibration, temperature, all these different nerves. And if you irritate a nerve as it comes off the spinal cord, usually by a bone being slightly out of place and somehow causing irritation, then you can get a symptom of whichever nerve is being irritated. So if you irritate a nerve to a muscle, the muscle could be weaker. If you irritate a nerve to an organ, you can have organ dysfunction, let's say a stomach making too much stomach acid, which can lead to an ulcer, or you can stimulate pain nerve and have pain. Chiropractors are specially trained to find which nerves are being irritated and then taking those bones that are slightly out of place, causing the irritation, and gently putting them back into place, taking the pressure or irritation off the nerve and restoring normal nerve function. So organ dysfunction goes away, or the pain fibers stop being stimulated, or the muscle function returns to normal. And that is the basics of chiropractic. It's been around well over 100 years. It's great technique. And for quantum neurology, in and of itself, I'm sorry, I misspoke, for complex regional pain syndrome, for CRPS, chiropractic care is not in and of itself enough to help get people into remission when we're talking about that 80%. But it does play an important role. And because every CRPS patient is different, some patients you can't touch. Some people with CRPS, you can touch their neck, but not their back. You could, touch their whole back, but not their extremities. Everyone is different. And therefore, a chiropractor that is treating people with CRPS, like myself, has to know multiple techniques, multiple ways to find that bone that is causing the nerve irritation and put it back into its normal position. And I do that uh, with multiple different techniques, multiple different tools. Some people can do the original type of chiropractic where we are manipulating the vertebra and you hear that pop. Some people you have to just barely, as lightly as you can, touch their neck with your finger and achieve the same thing, but in a different way. And so experience and knowledge play a huge role in being able to use chiropractic care for CRPS. The other technique that I have found that is major help with CRPS patients is a technique or a system of care actually called quantum neurology. Quantum neurology was developed by a doctor out in California about 25 years ago. And what it does is it uses the normal neurologic reflexes and systems of the body to impact other parts of the nervous system and help restore normal function. And I'll give you an example of what all of us do almost every day. If we bang our elbow into the wall, it hurts, right? What's the first thing we do? We rub on our elbow. And it doesn't matter if we are in North America and we do it, we bang our elbow, North Americans will rub their elbow. If you're a South American and you bang your elbow, you're going to rub your elbow. If you're an Eskimo or a Filipino or European or an Asian, no matter where you are, African person on planet Earth, all people, when they slam their elbow, in this example, they're going to instinctively lightly rub on their elbow. Why do human beings do that? We do that because when you hit your elbow and you have pain, 100% of those pain signals are going from your elbow up to your brain, and you go, wow, this hurts. So we instinctively know that if we stimulate another part of our nervous system, in this case, light touch, and lightly rub on our elbow, now we are stimulating the light touch nerves and sending those signals to the brain. Well, the brain can only receive so much information at any given time. So what it does is it says, okay, I'm going to take 30% less of the pain information that I'm getting so that I can get some of this light touch information. And then what is our perception as a human being is, oh, wow, when I rub my elbow that hurts, my pain drops by 30%. So that is an example of a neurologic trick, you could say, that we can use to get out of pain. Well, that's great if we don't have CRPS, but most people with CRPS light touch is terrible for them, right? You cannot do that. But I'm not using this as an example of what to do to get out of pain if you have CRPS. I'm just using it as an example of how the nervous system has lots of ways to overcome itself. Much in the way that a big part of the pain that a person feels with CRPS isn't really because the pain fibers are being stimulated, but it's those other sensory fibers. And we've talked about this in the past, like light touch, vibration, pressure, circumferential pressure, 2-point discrimination, all of these other types of sensory information that are going back to the brain, that when those nerves and receptors are misfiring, then they're overflowing onto the pain nerves, and then your perception is elevated pain. With quantum neurology, we are taking years and years of study to learn this system of care, study of the nervous system and various neurologic reflexes. We're coupling that knowledge with chiropractic and red light therapy to restore normal neurologic function. So when a person with CRPS comes to me, yes, I am going to use chiropractic within the limits of that patient. Yes, I'm going to use quantum neurology because it provides a deeper insight into the nervous system and use both of those techniques to help, along with all of the other things we do, find relief for a CRPS patient. In quantum neurology, one of the things that we have found is that quite often the body, in an effort to protect itself, will turn down nerve function or increase nerve function, what we call inhibition or excitation of the nerves, all in an effort to protect the body, heal the body. And for example, some people can have a hearing loss, right? They could have trauma. Maybe the trauma is from a loud sound. Maybe it's repetitive micro trauma, just this constant droning at a certain pitch. And this is can be very irritating to the brain. So the body, in its wisdom, says, well, if this frequency of sound, let's say A on a tuning fork, is irritating and creating inflammation in the brain, then if I can't get away from that sound, I'm going to decrease the ear's ability to recognize that frequency of sound. And then a person will become hard of hearing, somewhat deaf for that frequency. I'm sure you all know people that, like our parents or our grandparents, that some of them can't hear high pitched sounds, or some of them can't hear low pitched sounds. It just depends on the wisdom of that nervous system. But when we evaluate those patients, they don't actually have true nerve damage. What they have is an inhibition of those signals, those sound waves coming, in from the environment into the eardrum, being transferred to a neurologic signal, going to the brain, and right there, either on the nerve or in the brain itself, there's inhibition not to carry that irritating signal. The body does that as a protective mechanism. Well, that might have been great when you were exposed to that sound 5 or 10 years ago, and that helped you. But now a person isn't in that environment anymore, and yet they still have the neurologic deficit. We find this true with people that have any type of deficit, poor eyesight or loss of smell or taste or muscle function. I've seen a patient that was paralyzed for 25 years, unable to even stand, going from her bed to her wheelchair. And in one evaluation and then treatment, we were able to turn off those inhibition signals, restore normal nerve flow to her legs, and she was able to stand and walk all in one treatment. Not because we had neurologic or cellular repair, don't have cellular repair in an instant, but you can get rid of a nerve signal in an instant. And in those cases where either a nerve is being overexcited or overinhibited, we can use a technique like quantum neurology to find those and restore normal neurologic function. And this does play an important role in the pain and disability of people with CRPS. So again, chiropractic and quantum neurology are a very important, useful part of an overall program to put people with CRPS in remission, but they in and of themselves are not enough for 80% of CRPS patients to get into remission. It can all be fairly complicated, but you don't have to worry about that. That's my job as the doctor. I've been doing this 37 years, so I've got it pretty mapped out along with all of that experience and knowledge to be able to help. So if you have any questions, if you would like to know more, you can comment below this video, or you can always reach my office by phone or by email. Our number is pretty easy to find, and I look forward to answering any of your questions in the future. Hope you found this helpful, and I wish you all a healthier pain free